Chapter 8, Video 3. In this video, we're going to talk about a premature atrial complex, also known as a PAC. So PACs are known as premature atrial complexes. Premature beats that are fired out by the irritable atrial tissue before the next sinus beat is due, okay? So the sinus beat has fired away and it's going down the pathway, but with the premature atrial complex or a PAC, that atrial tissue just spits out another irritable beat. These may or may not be followed by a QRS. It depends on really how premature the PAC actually is. If the PAC or the premature atrial complex is very premature, it will not be conducted to the ventricle because it will arrive during the ventricle's refractory period where it can't take anything else, okay? So try to make sure that you understand that. So if it's very early, that ventricle's already busy. It's in that refractory period and it can't take any other activity. So it may, in this case, it won't be followed by the QRS. The premature atrial complex can actually occur at any rate, and it is actually a regular rhythm, but it's interrupted by what we call a PAC. The P waves in the PAC, they're shaped differently from the sinus P waves. So we'll see that sinus P wave, but the PAC, the premature atrial contraction, is actually shaped different. The premature P wave of the PAC may be hidden in the T wave of the preceding beat. If it's hidden there, it will deform the shape of the T wave. So we need to be suspicious when the T wave suddenly changes shape. So the PAC, the premature atrial contraction, it oftentimes deforms that shape of that preceding T wave. If one T wave is different, there's probably a P wave hiding in it. So if you're looking at a strip and all your T waves look uniform and then all of a sudden you have that one T wave that looks a little bit different, that P wave could actually be hiding in that T wave. If the P wave is inverted, the PR interval, the PR interval should be normal. It should be between 0.12 and 0.20. The most common cause of an unexplained pause is a non-conducted PAC. So oftentimes when we talk about that pause, you see that pause on the strip, oftentimes it is caused by a PAC that did not conduct. So it kind of fired early and the ventricles couldn't take it, so you don't see that QRS. So instead you have a pause. So if you see a pause and you're tempted to call it sinus arrest or sinus block, you need to make sure there's no P wave. And remember, that P wave can be hiding in the T wave. So make sure that it's a misconducted PAC. So if you see a pause and you're confused, you don't know whether it could be a sinus block or it could be sinus arrest, you look for that P wave. You may not see a distinct P wave. It may be hiding in that T wave. But take a look and look for that P wave, because if you see that P wave or that deformed T wave that indicates that P wave is hiding in there, then that would tell you that it's a premature atrial complex. Then it would be a non-conducted premature atrial complex. Certain causes of PACs could be medications, stimulants such as caffeine, bronchodilators, tobacco, or you could have hypoxia or even heart disease. These atria become hyper when you have these problems. With the premature atrial complex, it can be an early sign of impending heart failure, impending atrial tachycardia, or atrial fibrillation, okay? So know that if you see people that have PACs, this could be an early sign of heart failure. It could be an early sign of atrial tach or atrial fib. Patients usually do not have any ill effects from occasional PACs. However, they can lead to other arrhythmias and they can be an early sign of CHF. Usually there's no treatment needed, but if treatment is needed and the patient is symptomatic, they'll treat with digitalis, calcium channel blockers, beta blockers, oxygen, and they'll even remove stimulants from the patient's diet or whatever their intake is. So looking at this strip, we need to go through our same questions, okay? Are there QRS complexes? Are they uniform? Is the beat regular? Is it irregular? So we're going to go through those same 5 questions. But if you look at this strip, we see a PQRST, PQRST. We do see that this strip, we do see here that this is, we got some length here. The pulse rate is 60. But do you see what's happening here? We have an early beat. But look at this T wave. We have a PQRST, PQRS. Oh, look at this T. This one fired in earlier. So this gives us that premature atrial complex. So the 4th beat is premature as evidenced by the RR interval. Remember that premature beats have a short pause after, so we'll see that short pause here. The QRS complexes here, they're present, they're all the same. The regularity here is going to be regular. It's going to march out. If we count everything, it's going to march out except for this one area. So it's going to be regular, but it's regular but interrupted by a premature beat because we can see that there's a P wave hiding in that T wave. So the heart rate here is 54. The P wave actually precedes the QRS on all of them but the 4th one. Their matching upright P waves are the same. The premature P waves are not sinus. So the PP interval here is irregular because of that premature P. The PR interval is 0.16 and the QRS interval is 0.08. So the diagnosis here, we know we have this PAC. We know we have a little bit of a pause after. We know that pause was caused by this PAC because we can see the P wave hiding in this previous T wave. So with that being said, we're going to have sinus bradycardia because the pulse rate is 54. Sinus bradycardia with a premature atrial complex. Okay? A premature atrial complex, a premature P wave that is not followed by a QRS complex is a non-conducted PAC. Non-conducted PACs are the most common cause of otherwise unexplained pauses. And again, we need to remember the rules of a T wave, okay? Much of the time, the premature P wave is hidden inside of that T wave of the preceding beat. If the QRS complexes look alike and the T waves follow them, they should all look alike. If you have one T wave that suddenly changes, we need to look because that P wave could be hiding inside of it. So when we take a peek at this strip, this is considered a non-conducted PAC. The interpretation here is going to be sinus rhythm with a non-conducted PAC. And the reason we know this is non-conducted, and I'll go over that with you. The reason we know this is non-conducted, we see our T, P, QRS, T, P, QRS, T. This T looks slightly different. We have our P that comes in right here, but then we do not have a QRS that follows. So the rules are the same, but you see the P wave rolling in here at the end of this T wave, and then it does not have a QRS to follow, and then we pick back up and have another P. So this is a non-conducted premature atrial contraction. Again, we ask ourselves the same question when we work this strip out. QRS complexes are the same. The rhythm here is regular, but it's interrupted by a pause. The heart rate range is 43 to 75 with a mean rate of 70. The P waves are biphasic. Half of them are up and half of them are down and matching, except for the P wave that is at the end of that 3rd beat, which is right here. They're shaped differently. It's shaped differently because it's premature. Then when we look at the PP interval, all the sinus Ps are about 4 big blocks apart. The only 2.5 blocks from preceding P wave. A premature P wave that is not followed by a QRS is a non-conducted PAC. So this is sinus rhythm with a non-conducted PAC. And if you have any questions, please let me know.